As a patient, you should expect safe care, and you should also take steps to help ensure you receive safe care. Clear communication between you and providers and being an active member of your healthcare team is important for keeping you healthy and safe. Asking your doctors, nurses, and pharmacists and other healthcare providers questions so you understand your main problem, your plan of care, and what you need to do for your main problem is an important first step. Now, more than ever, patient and family engagement is needed to help you receive the best healthcare possible. You are an important part of the healthcare team. Be an active member of your healthcare team. Ask questions early and ask questions often. The National Patient Safety Foundation encourages you, the patient, to be an active member of your healthcare team by asking 3 simple but important questions every time you talk with a healthcare provider. The 3 questions are: what is my main problem? What do I need to do? Why is it important for me to do this? Ask me 3. Good questions for your good health.
Joe, I think your shortness of breath and swelling are caused by congestive heart failure. We need to schedule an echocardiogram to find out what the cause is. The echocardiogram will determine your ejection fraction and if there are any underlying issues with your heart valves. In the meantime, I'm going to start you on a couple of medications: Lotensin for your high blood pressure and Lasix for the swelling.
Okay.
Do either of you have any questions?
So I have high blood pressure? Is that my main medical problem?
No, high blood pressure is not your main problem. Your main problem is congestive heart failure. This condition causes your heart to be weaker and have to work harder to pump blood through your body. It can cause swelling in your legs, and it can cause shortness of breath.
Okay, I think my brother may have the same condition. What do I need to do?
First, before you leave, let's schedule an appointment for your test. After you leave, you need to get your 2 prescriptions filled. And finally, you need to take your Lotensin and Lasix. I suggest that your daughter and you write up a schedule for your medication.
A written schedule of my father's medications will help. Why is it so important for him to have the test and take these medications?
Those are really good questions. The echocardiogram will hopefully tell us exactly what's causing the heart failure. The test will also help us find out how far along the heart failure is. It's important to take your medications because you're helping your heart not work as hard. The swelling will decrease or disappear, and you're slowing down the disease. Does that help you understand why the test and medications are important?
Yes.
Yes, I understand. I'll make sure to schedule my tests and take my medications.
In this scenario, Joe asked 3 simple but important questions. By asking questions, Joe was able to be more informed about his main problem and everything he needed to do. Also, his family member was seen writing down the information. When you visit your doctor, if you're in the hospital or at the pharmacy, always ask and write down the answers to these questions. What is my main problem? What do I need to do? Why is it important for me to do this? For more information about Ask Me 3 and communicating well with your healthcare providers, visit www.npsf.org.